Hope audio, video, everything is okay. Just type in the chat box, audio, video, okay. Everything is. I'm checking. Yes. Fine. I got the feedback. Audio, video is okay. We'll go to the question. First question. Which toxin of the Staphylococcus aureus act as a super antigen? What is super antigen? The antigen which bypasses phagocytosis, antigen processing, antigen presentation, everything it bypass. Directly it attach with variable beta side chain of T cell receptor of CD4 cell. Then we call it as super antigen. We call it as super antigen. The important super antigen is Staphylococcus is exfoliative toxin mainly. Another one is toxic shock syndrome toxin. These are all the major super antigen. These are all the major super antigen. Okay. Next is alpha toxin, protein A. These are all antigens, virulent factor, but they are not super antigens. Next is Streptococcus pyogenes is best identified by which microbiological test? Lot of microbiological tests given. Optochin sensitivity, please note down. Optochin sensitivity, bile solubility, mainly for Streptococcus pneumoniae. CAMP test as well as Hippurate hydrolysis, mainly for group B Streptococcus, otherwise called Streptococcus agalactiae. And the major biochemical test for Streptococcus pyogenes is bacitracin sensitivity test. Bacitracin sensitivity test. Okay, bacitracin sensitivity test, mainly for group A Streptococcus. It is mainly for group A Streptococcus, otherwise called Streptococcus pyogenes. One more test is POR test. These are the tests mainly for group A beta hemolytic Streptococcus. It is the most common cause of bacterial pharyngitis, most common cause of bacterial pharyngitis, impetigo, necrotizing fasciitis, it is the most common cause of bacterial pharyngitis, impetigo, necrotizing fasciitis, many things. So Streptococcus pyogenes is best identified by bacitracin sensitive. Group B Streptococcus CAMP test positive. Optochin sensitivity, bile solubility, inulin fermentation. You can add one more also. That also important exam point. Inulin fermentation. Streptococcus pyogenes. You must know. inulin fermentation, bile solubility, optochin for pneumococci. Next is optochin sensitive bile soluble organism causing lobar pneumonia. Already we discussed optochin sensitivity, bile solubility, inulin fermentation. You can go for directly Streptococcus pneumoniae. And Streptococcus pneumonia causes the important virulent factor is polysaccharide capsule. Polysaccharide capsule. Streptococcus pneumoniae, polysaccharide capsule. Everybody aware of that. It is like this. Flame shape or lanceolate shape. Flame shape or lanceolate shape. And can you name the disease? The mnemonic is called poems. It causes pneumonia, otitis media, epiglottitis, meningitis, and sinusitis. It causes pneumonia, otitis media, meningitis, and sinusitis. Usually treatment ceftriaxone. It produces carom-coin colonies. These are all the key points you must know. It produces carom-coin colonies. Like this. Other name, Draughtsman colonies. It produces Draughtsman colonies. Carom-coin colonies or Draughtsman colonies. Next is spore forming anaerobic bacilli causing gas gangrene. What is gas gangrene? You can see crepitus, gas bubbles in the muscles. That is called gas gangrene. Is a deadly condition caused by an anaerobic bacteria called Clostridium perfringens. Clostridium perfringens. Everybody knows tetany causes tetanus. Spastic paralysis. Yes or no? Difficult to see nowadays because of proper vaccination. Difficult to see because of proper vaccination. Anybody seen tetanus? No. Clostridium botulinum. It produces flaccid paralysis. Flaccid paralysis. Both act on neuromuscular junction. Tetany inhibit the release of GABA glycine and botulinum toxin inhibit the release of acetylcholine. Clostridium difficile. It causes pseudomembranous enterocolitis, antibiotic associated. That is important. Very important, my dears. If you give antibiotic on the day 5, the person develops diarrhea. Antibiotic associated pseudomembranous enterocolitis. Pseudomembranous enterocolitis. Next is tetanus toxin acts by the blocking release of. Just now we discussed tetanus toxin. The name of the toxin is called tetanospasmin. You must know the mechanism of action of all toxins. Tetanospasmin. It cleaves snare protein. That is important. What protein? Snare protein. Cleaves snare protein. And inhibit the release of GABA and glycine. Inhibit the release of GABA and glycine. We call it as inhibitory neurotransmitters. It is otherwise called inhibitory neurotransmitters. We call it as inhibitory neurotransmitters. Where everything is happening. Tetanospasmin cleaves the SNAR protein, inhibit the release of gamma glycine. Where? Presynaptic area or neuromuscular junction. Presynaptic area or neuromuscular junction. Presynaptic area or neuromuscular junction. Presynaptic area or neuromuscular junction, which leads to spastic paralysis. What is the classical picture? Trismus, lockjaw. Finally, opisthotonus, otherwise called hyperreflexia, starting from trismus to opisthotonus or hyperreflexia. Hyperreflexia. So it inhibits the release of GABA and glycine. Acetylcholine inhibition, botulinum toxin. Mainly botulinum toxin. You must know the mechanism of action of toxins, exotoxins. Next is metachromatic granules best demonstrated by. Beautiful question. What is metachromatic granules? It is otherwise called any other name? Babes-Ernst granules. Very good. Babes-Ernst granules. Babes-Ernst granules. We call it as Babes-Ernst granules. Another name is volutin granules. Very good. Volutin granules. Babes-Ernst granules, otherwise called volutin granules. Any other name? Polar bodies. So, how to demonstrate? We are using a medium called Loeffler's serum slope. We are using a medium called Loeffler's serum slope. Once it grows in Loeffler's serum slope, we are demonstrating in microscope by stains. There are three important stains. What are the important stains? We call it as PAN. The mnemonic is PAN. What is PAN? Ponder stain, Albert stain, Neisser stain. Ponder, Albert and Neisser stain. Ponder, Albert, Neisser stain. Anyone? Demonstration of metachromatic granules. By answer here is beautifully they mentioned. It is Albert stain. Gram stain to differentiate bacteria into gram positive, gram negative. Ziehl-Neelsen is acid first stain. Giemsa stain mainly we are using for intracellular pathogens like malaria, chlamydia, like intracellular pathogens. Mainly Giemsa stain. Zeal-Nielsen mainly for acid phosphate. Got it? Next is kidney-shaped diplococci inside neutrophil in urethral discharge. That's all. It's a beautiful clue. Urethral discharge and kidney-shaped diplococci, usually gram-negative. That's the pathogenous gram-negative inside the polymorphonuclear cells, inside the pus cells. Inside the pus cell, you are getting kidney-shaped gram-negative cocci. The condition is called gonorrhea. This is Neisseria gonorrhoeae. Neisseria gonorrhoeae. Because Haemophilus influenzae is gram-negative bacilli. These are all gram-negative cocci. Neisseria meningitis is lens shape. Gonorrhea gonococci is kidney shape. It causes a condition called gonorrhea, urethral discharge, water can perineum, multiple abscess with the discharge in perineal area, water can perineum, and also it causes water can perineum, endocervicitis, rash, and septic arthritis in young women. Septic arthritis in young women. These are all the key features of gonococci. What is the selective medium we are using? Gonococci or Neisseria, the common selective medium, mainly for Neisseria. The common selective medium is modified Thayer-Martin agar. Or modified New York City agar. Modified Thayer-Martin agar or modified New York City agar. Usually the treatment, you can go for ceftriaxone, syndromic approach, cefixime with azithromycin combination. You must know gonococci and meningococci in and out, not only for exam point of view, day-to-day practice. Next is, which Neisseria has a polysaccharide capsule? Polysaccharide capsule mainly produced by 3 pathogens. Mainly, many people, we call it as NHS organism. Neisseria meningitis, Haemophilus influenzae, Streptococcus pneumoniae, meningococci, gonococci, and Haemophilus influenzae. All these people possess polysaccharide capsule. Polysaccharide capsule. Polysaccharide capsule. And it causes mainly meningitis. It causes meningitis. In adults and adolescents. It causes meningitis in adults as well as adolescents. And Waterhouse friction syndrome, fulminant meningococcemia, adrenal bleeding, adrenal destruction, adrenal hemorrhage, toxemia it produces. Septicemia, fulminant meningococcemia, we call it as Waterhouse friction syndrome. Waterhouse friction syndrome. Treatment usually ceftriaxone. Treatment ceftriaxone. Next is lactose fermenting indole positive bacilli causing UTI. Indole positive lactose fermenter, most common cause of UTI is a direct question, is Escherichia coli. Klebsiella also causes, but Klebsiella indole negative. Klebsiella indole negative. Klebsiella pneumoniae indole negative. Protease causes UTI, but it is sometimes indole positive negative. It is non-lactose fermenter. Salmonella, it won't cause UTI usually, but it is non-lactose fermenter. So, UTI causing bacteria, remember the mnemonic. You remember my mnemonic? Keeps. What is keeps? Klebsiella pneumoniae, E. coli, Enterobacter, and Enterococci, Proteus. Can you remember? Pseudomonas, Staphylococcus, Staphylococcus, Serratia. These people are common agents causing UTI. So most common cause of UTI overall, most common cause overall is E. coli. And it is a lactose fermenter. Among the choices, lactose fermenter, indole positive is E. coli. And it is motile also. Second most tough choice is Klebsiella, because that also lactose fermenter, but indole negative. Next is swarming motility characteristic of. Many people exhibit swarming. Swarming is a wavy growth. The bacteria, this is the colony. The bacteria grows like that. This is called wavy growth. We call it as swarming. Swarming is classical character of Proteus, because Shigella and Klebsiella are non-motile. So there is no swarming. There is no swarming. No swarming. Got it? Just a minute. Just a minute. Okay, right. So no swarming. My monitor had some problem. I read it. E. coli is motile, but it won't produce swarming. Other people which produces swarming are, many people produces swarming. Vibrio parahemolyticus, Clostridium tetani, Campylobacter jejuni. Many people produces swarming. apart from Proteus. Vibrio parahumanicus, Campylobacter jejuni, Clostridium tetani, these people are notorious at producing swarming. Swarming is a type of motility we can appreciate in the culture medium. Next is Vidal test or Vidal test. Detect antibodies against. Vidal test is a agglutination test to diagnose second week of illness of typhoid fever, enteric fever. We are finding antibodies against O and H antigens. It detects H antibody, otherwise called flagellar antibody, or O antibody. We call it as somatic antibody. We are using somatic antigen as well as flagellar antigen. As well as somatic antigen we are using. We are finding somatic antibody or flagellar antibody. The O antigen is very common. We are using only TO, typhoid salmonella typhi O. But H antigen vary from bacteria to bacteria. We are using TH, AH, BH. H antigen of Salmonella typhi, H antigen of Salmonella paratyphi A, H antigen of Salmonella paratyphi B. We are using these three. But nowadays this test is not up to the mark because India is endemic for India is endemic for typhoid. Everybody is having antibodies. The antibody test may not be helpful to confirm the diagnosis or treatment. VA antigen, no. K antigen is capsular, E. coli. The Salmonella endotoxin is not much effective. Some bacteria endotoxin may not be effective. One is Salmonella. Next is rice water stool diarrhea, classical. Some points are very classical. Pea soup diarrhea, where you can get typhoid. Pea soup diarrhea, typhoid. Rice water stool diarrhea, Vibrio cholera. Rice water stool, Vibrio cholera. Because it increases cyclic AMP. Stimulate adenyl cyclase, increases cyclic AMP. Outpouring of water and electrolytes leads to secretory diarrhea. The cholera toxin, secretory diarrhea. Salmonella Shigella usually produces bloody diarrhea. E. coli mixer. E. coli, for example, it causes enteroinvasive E. coli, enterohemorrhagic E. coli. These people produces bloody diarrhea. Enterotoxigenic E. coli, cyclic AMP, watery diarrhea. Enteropathogenic E. coli, cholera infantum, looks like cholera. And rice water stool are the classical feature for Vibrio cholera. What is the selective medium? The selective medium for Vibrio cholera, they may ask you, TCBS agar, thiosulfate, citrate, bile salt, sucrose agar, thiosulfate, citrate, bile salt and sucrose agar. Rice water stool or senin. Next is which organism causes pseudomembranous colitis? Just now we discussed pseudomembranous tonsillitis caused by diphtheria. Pseudomembranous colitis caused by Clostridium difficile. Antibiotic associated, mainly clindamycin, aminopenicillin, can anyone tell one more antibiotic important group is cephalosporins, third generation or more than that, cephalosporins. Clindamycin, aminopenicillin, cephalosporins, Clostridium difficile. And classical treatment, what are the important treatment? First line treatment is vancomycin. In case of vancomycin failure, can you name the treatment? In case of vancomycin failure, fidaxomicin. Vancomycin failure, we can go for fidaxomicin. Fidaxomicin. Clostridium difficile, we call it as healthcare associated diarrhea. Previous name, hospital acquired diarrhea. It causes healthcare associated diarrhea. Healthcare associated diarrhea. Next is cold agglutinin are associated. That's a clue. Cold agglutinin test. You can see in associated with cold agglutinin, IgM, cold antibody, cold agglutinin, seen in Mycoplasma pneumoniae. Coxilla causes Q fever. Legionella causes atypical pneumonia. Chlamydia causes many diseases which include trachoma, LGV, pelvic inflammatory disease, non-gonococcal urethritis, psittacosis, pneumonia, atypical pneumonia, etc. Chlamydia. Cold agglutinin test associated with Mycoplasma pneumonia. We call it as CAT test. CAT. Cold agglutinin, we shortly call CAT test. Cold agglutinin CAT test. Treatment for Mycoplasma pneumoniae, drug of choice is azithromycin. Can you name what is the culture medium? Sometimes they may ask. PPLO agar. The culture medium is PPLO agar or eaten agar. PPLO agar or eaten agar. Obligate intracellular organism with elementary bodies. Obligate intracellular organism with elementary bodies. Elementary bodies. See, in these choices, obligate intracellular is rickets and chlamydia because Mycoplasma culture medium available, PPLO agar, just now I told, Legionella BCOE agar. So these three people are not obligate intracellular, rickets and chlamydia. Chlamydia available in two format. One is extracellular elementary bodies. Another one is intracellular reticulate bodies. Extracellular elementary bodies. Another one is intracellular reticulate bodies. Intracellular reticulate bodies. I'm sorry. Reticulate bodies. Extracellular elementary bodies, intracellular reticulate bodies. What is the function? Elementary bodies mainly for infectious, go and capture new cells. It is infectious. Reticulate body, it is captured inside the cell. They start multiplying, replication. Obligate intracellular with elementary body and reticulate bodies. Next is Weil's disease. You should know the other names of the diseases. Trypanosoma, we call it as great pox. Syphilis, great pox. Spirilla minus, it causes rat bite fever. Borrelia causes many diseases. Borrelia recurrentis, it causes relapsing fever, Vincent's angina, Lyme disease, many things. Lyme disease, relapsing fever, many things it causes. And leptospirosis, otherwise called, sorry, here obligate intracellular elementary body is chlamydia. Answer is chlamydia. Weil's disease, what is the other name? Is leptospirosis. It has many other names. A big list of names. Rat fever, rain fever, paddy fever, Andaman fever, mud fever, pre-tibial fever, swamp fever. Like it is having lot of other names. I used to tell in the class. Can you remember? It is having 100 names. We call it as 100 name bacteria. It is having 100 names. We call it as 100 named bacteria. 100 named disease. Okay. Next is, I'm sorry. Undulant fever is seen in. Undulant fever is the other name for brucellosis. Undulant fever, otherwise called brucellosis. Yersinia causes plague. Francisella causes rabbit fever. Pasteurella causes cat bite abscess. Cat bite abscess. Brucella, it causes undulant fever. Other name, Malta fever. Or one more name, Mediterranean fever. What is the selective medium? There's a beautiful selective medium. What is the name? Castaneda. Remember all those things, my dears. Castaneda biphasic medium. Castaneda biphasic medium. Castaneda biphasic medium. Next is plague is transmitted by, you should know the vector for all the vector-borne disease. Plague caused by Yersinia pestis. It is transmitted by rat flea. We call it as rat flea. Other name Xenopsilla chopsis or Xenopsilla astia. Mosquito malaria. Louse is the vector. Louse is the vector for trench fever or epidemic typhus. Louse is the vector for epidemic typhus, trench fever. Tick is the vector for Rocky Mountain spotted fever, Indian tick typhus, Ehrlichia, many other conditions. Lyme disease, Caissenus forest disease. Many conditions, tick is the vector. Babesia, many conditions, tick is the vector. Which organism causes cat scratch disease? Just now I told. Cat scratch disease caused by Spirilla minus. But that option is not here. Sorry. Cat scratch disease caused by, which one causes cat scratch disease? Bottonella hensley. It causes cat scratch disease. Pasteurella produces cat bite abscess. Spirilla minus and Streptobacillus monodiformis causes rat bite fever. Brucella causes Malta fever. Francisella tularensis causes tularemia, rabbit fever. So Bottonella hensley, it causes cat scratch disease. Another one is, it also causes bacillary angiomatosis. Bacillary angiomatosis. Bacillary angiomatosis. Got it? Runyon's classification applies to. Runyon's classification. Atypical mycobacteria, Runyon's classification. Sir, what is Runyon's classification? Can you remember? We are classification based on two criteria. One is growth rate. We have rapid grower and slow grower. Rapid grower and slow grower, Runyon's classification. Another one is pigment production. Pigment production. Growth rate, pigment production. Runyon's classification. We are classifying into photochromogen. Can you remember? Photochromogen. Non-photochromogen. and rapid growers. And rapid growers. Photos, coto, non-photo and rapid growers. Which bacterium causes relapsing fever? Relapsing fever is caused by Borrelia recurrentis. Relapsing fever, there are two types. One is called epidemic, another one is endemic. Epidemic caused by Borrelia recurrentis because antigenic variation on the surface. Endemic caused by Borrelia duttonii. Vector for this fellow is louse. Here vector is tick. Both treatment usually doxy. Relapsing fever caused by Borrelia. Next is which bacterium transmitted by ticks? You know the list. Brucella is zoonotic disease. Pasteurella zoonotic. Vibrio waterborne. Ehrlichia vector is tick. It causes ehrlichiosis. Classical picture is morula formation. Classical feature is morula formation. Is the classical picture, morula formation. Next is which organism causes chancroid? Chancroid is a painful ulcer. Painful ulcer. Usually it is caused by chancroid Haemophilus ducreyi. Because Treponema pallidum produces syphilis, it produces painless. We call it as soft hot chancre. Haemophilus ducreyi produces soft chancre. Other name chancroid. Neisseria gonorrhea mainly produces urethritis. This fellow produces non-gonococcal urethritis. Chlamydia produces, Trachomatis produces non-gonococcal urethritis. Neisseria gonorrhea produces urethritis. So chancroid is a condition caused by Haemophilus ducreyi. Treatment azithromycin. It has typical school of fish. School of fish. Got it? Or fish in stream. So school of fish or a tram track arrangement. Fish in stream is Vibrio cholera. Tram track. Next is which bacterium causes melioidosis? Which bacterium causes melioidosis? Melioidosis is a clinical condition, zoonotic disease caused by Burkholderia pseudomallei. It is safe tip in appearance, this bacteria. Motile bacteria. Other name for melioidosis is Vietnam time bomb. Very good. Komeleshwa. Vietnam time bomb. What is the selective medium? Ashdown medium. Yersinia pestis causes plague or black death. Francisella already told tularemia. Brucella, Malta fever, and Mediterranean fever or undulant fever. Pontiac fever is caused by. Pontiac fever is a mild form of Legionella. Flu-like symptom. Because Coxella produces Q fever. Legionella pneumophila. It produces Pontiac fever, mild fever, flu-like symptom. Selective medium is, can anyone tell what is the selective medium? BCYE agar. Buffered charcoal yeast extract agar. Drug of choice, it won't take gram stain. These are the key points. Legionella takes a stain called Dieterle stain. It takes a stain called Dieterle stain. And treatment, azithromycin. Commonly seen in air conditioners or water theme park, wherever aerosol production, commonly we are getting Pontiac fever. With this, we have completed key points as key questions, key topics in systemic bacteriology. It's a huge one. Okay, go through this. If you have any doubt, you can contact me either through the app or through the Telegram group. You can contact me. You know, my Telegram group is Micro Magics. Many people are member there. Don't worry. You can contact me, or you can contact me through DAM's official group or in eMedicos. Tag me. Any doubt? Just type the chat box. I'll wait 1 or 2 minutes before closing the session. I'm waiting for you. If there are no doubts, then I'm closing the session. Thank you very much. God bless you. Soon I'll see you with another topic, mainly virology. Okay. Thank you. I got a question. Sir, why after splenectomy capsulated organism predominant? What is the function of spleen? Spleen will filter as well as it act against capsulated pathogen. Okay. If there is no spleen, capsulated pathogen become happy because they are not having anybody to control. So those people cause fulminant disease in case of splenectomy. So that is the reason we are telling any patient undergoes splenectomy must be vaccinated against capsulated pathogens. Got it? Capsulated pathogens mainly destroyed in spleen. It plays a major role in controlling a capsulated pathogen. It acts as a filter. Got it, my dear? Okay. Further more question? Okay. I'm waiting. Just I'm seeing the chat box in my mobile. Yeah. In the YouTube.